Hello, I'm Audrey Hunt. I'm a nurse practitioner here at the Springview Clinic in Springfield, Kentucky. I've been with the Springview Clinic since 2010. I opened up this clinic with Springview Hospital at that time. Since then, we've grown into a much bigger practice. We've moved locations. We're here at Bobolink Drive here in Springfield behind Pizza Hut, and we have grown to 3 providers. I am actually originally from Marion County, Kentucky. I was born and raised there, graduated from Marion County High School. After that, I went to college, got my bachelor's through Western Kentucky, my master's through U of L, but I still bleed blue. Go UK. I am married. I have 2 children, 2 little girls, and I currently reside here in Washington County. So here at the clinic, we are actually a family practice clinic. We take patients of all ages, all the way from infancy to the elderly. We also do take walk-ins as well. Walk-ins are welcome for any acute type illnesses, whether it's common flu, cold, sore throat. And as far as the primary care, we take chronic conditions such as high blood pressure, diabetes. We treat a lot of anxiety, depression, any needs you may have. The clinic is opened 6 days a week. We are really trying to make this accessible for the community. We understand a lot of families do work, and of course kids are in school during the work hours. So we are opened Monday, Tuesday, Wednesday, and Thursday from 8 a.m. till 7 p.m. On Fridays, we are open from 8 a.m. to 4:30, and we do offer Saturday hours from 8 a.m. to 12 p.m. Our Saturday hours, we do only accept walk-ins, so we just do acute illness visits on those days. When we started this clinic, we felt there was a need. There was actually not many providers here in Springfield, Kentucky at that time, how it's grown over the last couple of years. But we felt like there wasn't a lot of access when we first started for people for acute illnesses. That's how the clinic originally started. We started out just seeing acute visits. You know, people were having to go to the hospital, or people were having to go to Bardstown or to Camelsville in order just to get access for a simple sore throat or a hurt toenail. And so we felt like we could really make that accessible to the community. And then we found there was a much more of a need for primary care. Therefore, we did start extending our services and have now added 2 other providers.
Hi, my name is Stephanie Harmon. I was born and raised here in Washington County. I actually went to Washington County Elementary, Middle School, and High School. I got my master's degree in family nurse practitioner at Frontier Nursing University, and I wanted to come back home to help our community. I have been here at Springview Clinic for 5 years now, and I love it. We have really grown as a practice from when I first came. So family nurse practitioner, basically we can see the whole entire family, from infant until the elderly. So that means that if you come in with your child, you can also be seen as well. So it really gives us a broad aspect of the whole dynamic of the entire family. So as a family nurse practitioner, we can order any kind of test, any lab results that we would like. We can prescribe medications. We can get you set up with physical therapy. We can get you set up with home health. And basically anything that you would need that a family doctor would want to order in a family practice setting, we can do that as well. Growing up here in Springfield has helped so much, being able to come back and work with the community, because most of the people that I grew up knowing, I get to see on a regular basis. So I know them, I know their families. A lot of times it's very helpful that I've known them my whole life, because I kind of know what their situation is, or their environment, or their family history. I know that their aunt or uncle had cancer, so we talk about that, and we talk about early screening tests, and really getting them in and doing those early detection things. So it's really helpful, and it just is such a blessing to be able to work in the community that I know and love, and that I'm born and raised in. So it's very, very special and close to my heart.
My name is Mandy Fitted Toe. I am a nurse practitioner. Just started here about a month ago. Originally from Loretto, and moved to Bardstown when I was a child. I went to Bardstown High. I graduated with my BSN from U of L, and then graduated with my master's in nursing from Indiana Wesleyan University. I started at a nursing home actually with Dr. Bobber in Louisville. Worked doing that for about a year, and then left there and went to Kentucky One Urgent Care. So I really got affiliated with both chronic care issues in the nursing home, rehab, things of that nature, and then moved to urgent care and got used to, seeing all of the acute care visits, which is great because we handle both here. It's nice to have a family clinic in a rural setting because sometimes those aren't readily available, and the fact that this family clinic offers both chronic and acute care and it is affiliated with the hospital. There are so many resources that normally wouldn't have been available to the residents in Springfield, so we can send them over to Lebanon to have further testing, mammograms, x-rays, CTs, anything of that nature, and we are given those reports automatically, just sent directly to us. And it's also great that we're able to refer care to a general surgeon, podiatry, gynecologist, anything like that, and everything is in the same system. Audrey, she has a late night. Stephanie has a late night during the week, and then I actually have two. We take patients until 6:30, Monday through Thursday. So that's great for those who have life in general, then they can't get here during normal business hours. Right now, I am currently taking in new patients.
And I feel like we're not only just providers here, but we're also caregivers who truly care about the community and see our patients as our extended family as well.